Hello, my topic is hepatocellular carcinoma. Definition: hepatocellular carcinoma is a primary malignancy of the that occurs predominantly in patients with underlying chronic liver. If caught early, it can sometimes be cured with surgery or transplant. In more advanced cases, it can be cured, but treatment and support can help you live longer and better.
Here is another liver. In the southeast, we could see large nodules of liver, perhaps a macronodular type of cirrhosis, in which you could recognize that we still can basically make out liver cords, but they are separated by bands of dense fibrous connective tissue that gives them a very, very nodular pattern. Let's go back and look at these other nodules in the liver, the ones that appear darker and more hyperchromatic and less like liver. It is very hard to recognize this as being true liver cells. They don't look like normal liver cells here, like they do down here. This is hepatoma again. This is another hepatoma that has arisen within the soil of cirrhosis, which most of them do. And whatever causes hepatomas usually does its job in the middle of a cirrhosis framework. Yes, we have irregular nodules, but they no longer look like liver cells, which have, by the way, still fairly round, fairly uniform, still fairly centrally located nuclei. Whereas when you look at the cells of the hepatoma for comparison, they are large, they are irregular, as composed to the fairly uniform regular nuclei here. Another thing I want to point out quickly, and I hope I can, is that also in this field you see something instantly very red up here in the northwest. And usually when you see something very red, it's either extreme blood, extreme fibrosis, or extreme necrosis. So let's see what it is. Well, this part is certainly very red because of fibrous tissue. But I think that the real red stuff to me looks like an area in which you cannot differentiate cellular structures anymore. So this is the red of necrosis, isn't it? Uh, and all of these cells out here, pigmented, could very easily be macrophages that have either taken up blood pigment or perhaps bile pigment, because we're in the liver, aren't we? Thank you very much.
Application in medicine. In 1981, after Beasley leaked hepatitis B virus infections to hepatocellular carcinoma development, the cause of it was thought to have been identified. However, subsequent studies failed to identify hepatitis B virus infections as a major independent risk factor, and it became apparent that most cases of hepatocellular carcinoma development in patients with underlying cirrhotic liver disease of virus etiologies.
Hepatocellular carcinoma is a primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. It's the third most common cancer in the world and one of the leading causes of cancer deaths. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or the other, they may be suitable for a resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patient. The advantage we have at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. We have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall. And the patient is directed towards the most appropriate care, rather than being filtered into what the center is an expert at. We're an expert at all three modalities of treatment rather than just the one.
Pros and cons. Pros: hepatitis B carriers have a 10% 25% lifetime risk of developing hepatocellular carcinoma, alcohol consumption and cigarette smoking, diabetes and obesity. Cons: hypoglycemia and hypercalcemia, polycythemia, erythrocytosis. It is believed to occur by synthesis of erythropoietin by the tumor. Use applied in Ecuador. Hepatocellular carcinoma is a prevalent disease in Ecuador, with a high rate of healthcare cost and mortality. It isn't available yet some private or public program that allows that patients with cirrhosis access to transplant.
Content to a recent webcast. Watch doctors from the Center for Liver Disease and Transplantation of New York Presbyterian present their research findings on the diagnosis, treatment, and survival rates of hepatocellular carcinoma. Hepatocellular carcinoma, or HCC, is the most common form of primary liver cancer. It accounts for about 80 to 90% of new liver cancer cases, and there are about 21,400 new cases diagnosed each year in the U.S. For unknown reasons, the disease is more common in men than women, and a typical patient is around 65 and has had cirrhosis for a decade or more. We've got an update with new information from this previously presented show. Get the latest on hepatocellular carcinoma.
Conclusion: primary liver cancer is the fourth most common tumor worldwide. Hepatocellular carcinoma occurs mainly in the context of cirrhosis, hepatitis B or C, virus infection, or non-alcoholic steatohepatitis. Underlying liver disease limits therapeutic efficacy. Most people do not have any noticeable symptoms associated with hepatocellular carcinoma.